This is the Emergency Medical Minute, brought to you by HCA Health One.
Good morning. So today I wanted to talk real quick about pain control, specifically related to NSAIDs. So my first question to you guys is Ketorolac more efficacious in terms of pain control than just straight ibuprofen?
No, according to the studies.
Yeah. So the answer is no. And they have done multiple double-blind studies head-to-head of ibuprofen versus Ketorolac, and they have found that the analgesic effect of ibuprofen versus IM Ketorolac is the exact same. So why do we do it?
It makes them feel better to get something in the right.
Or IM is what a lot of times. So is that true though?
Placebo.
So they've actually studied this, and when they've done head-to-head trials of IM versus ibuprofen Ketorolac, patients actually preferred the oral version of ibuprofen because of the pain of the shot of the IM Ketorolac. The onset time, it might be a tiny bit faster with Ketorolac, but it doesn't. It's so small, it's really insignificant. So then, the big question is, what is the difference in terms of cost of Ketorolac versus ibuprofen and length of administration? It's longer, right? So it takes you longer to get the Ketorolac ready, draw it up, and give it, right? And the cost is higher. And so what my conclusion on this is that we should be probably giving more ibuprofen just orally versus IM Ketorolac, right? Obviously, in those patients who can't tolerate oral intake, that's a different story. But in general, we should be pushing for oral ibuprofen. The last piece I wanted to talk about is specifically related to Ketorolac. What about the dosing of Ketorolac? What do you guys think is the normal dosing of Ketorolac?
15.
Yeah. And so do you think there's a difference in terms of 10, 15, and 30 in terms of pain management? No, but you actually have increased bleeding risk, increased GI effects, increased nausea effects with the higher doses. So the two pieces that I want you to take from this is ask the providers, hey, could we be giving oral ibuprofen? And if you see doses above 10 milligrams of IV Ketorolac, you should be asking, hey, I thought that the studies showed that they're the same. Should we just give a lower dose because it's got less side effects? So these are things that we can do to help with first patients in terms of the pain that they get from the shots, but also cost to the system and speed of administration. So that is that.
This has been the Emergency Medical Minute. Thank you for listening, and thank you to HCA Health One for their financial contributions. Support from them and from listeners like you helps us achieve our goal of spreading free education to the masses. If you'd like to help, please donate. Follow the link in our show notes. Thanks for listening.